local anesthetic. The procedure takes about 5 minutes. There's no incision, no hardware.
Did you feel that pressure there, Rusty? Okay, and your disc is now back up to a normal height.
Typically, at first, patients feel discomfort.
Some patients even say, gosh, I wish I never had this done. And then several weeks later, the patients just turn a corner. We tell them that they can expect that there'll be one day where they have pain, and the next day, it'll just stop.
PASA is hoping for Food and Drug Administration approval of the procedure by 2015. Phase 3 clinical trials are underway now at 20 sites around the United States. Dr. PASA has successfully treated more than 1,000 patients in his private practice.
We started treating the first patients approximately 5 or 6 years ago, and the success rate is approximately 86%.
So how did Rusty Templeton do?
My pain before was at least a 10.
And 2 months after the procedure?
It's still around a 5 because I have underlying issues, but I can lay down now. I don't sleep in the recliner, so things are better in that way. I can, walk around. I can drive where I couldn't drive before.
The pain level I had before the procedure was probably around 6 to worse 8.
Christopher Joseph was in a car accident. How was his pain 2 months after the procedure?
Right now it's at 0.
Is this some wild and crazy idea, or is this something that really has promise?
I think it does possess incredible potential and therefore promise.
Dr. Michael DePalma is a spine specialist in Richmond, Virginia. The North American Spine Society has just published his paper on the latest experimental therapies involving disc restoration.
Stem cells are something that's being investigated to replenish cells within the disc by injecting them into the disc directly. Injecting growth factors, which are proteins to try to stimulate repair of the disc, have also been evaluated and investigated.
DePalma is involved in 4 different FDA trials of the new procedures and believes these so-called biologics are the future of back treatment. Based on the results so far, he thinks Dr. PASA's fibrin sealant offers the most promise. If Dr. PASA pulls this off, even if it's 50% successful with someone, is that significant?
It'd be huge.
And then there's the cost. Compare spinal fusion and fibrin treatment.
Treatment for a fusion, and this is the hospital fee, typically is in the $100,000 range, not including the physician's fee. Again, we don't have a set cost for this treatment yet, but it's approximately 95% less than the cost of a fusion.
PASA expects it to be widely available within 5 years.
It's the first time in history that we've been able to cause new tissue to grow within the spines. This procedure is the procedure that really the world has been waiting for.
Is it? The procedure is only for back pain sufferers with specific disc problems, but there are a lot of those, and Dr. Kevin PASA is absolutely sure he's found a better, safer, cheaper way of improving their lives.
It's a little bit easier than surgery, isn't it?
Oh, yeah.
You did great. We're going to let you rest and recover.
Next, a voice from the past. All your life, you've been trading up. You exchanged the third-floor walk-up for the house you had your heart set on. So now that you're comfortably